for this speech, I had to make a poster for the first time since like 4th grade, and it turns out I haven't gotten any better at it. And you might be thinking, why are you drawing attention to the fact that your poster is bad? Well, you see, it's fine, because it's here. But that's not the attitude you should take when you're shoving needles through someone. So, that brings us to today's topic, temporary piercings. My name is Maddie, and I'll be talking to you about this topic. So, temporary piercings are also known as play piercings. And disclaimer that I am not a medical professional, and if you do this based upon the information contained in the speech, then it's not my fault if you get some sort of horrible infection. Okay, so in this speech we're going to go over uses, precautions, process, and conclusion. So the main uses are it's used in kink and a lot of BDSM scenes for pain play, and it's used in photography, especially for corset piercings, which is when there's little rings down the back and it's laced up like a corset. So a lot of artistic photographers use this. It's also used in spirituality and some Native American tribes and other cultures. It's kind of a rite of passage thing in some places. So, important precautions. There are many. So it's worth it to note that when used in kink, this is RAC, which is risk-aware consensual kink, and not SSC, which is safe, sane, and consensual, which recognizes that there is an inherent risk and that anyone undertaking this should be aware of that risk. So, our health precautions include bloodborne pathogens can pass from one person to another if blood is shared, such as through a pinprick or such as through people not wearing gloves. Hitting veins or arteries can cause severe or minimal blood loss, but it's not a good idea to do it either way. Alcohol and drugs can cause blood loss because they cause lack of clotting, so it's not a good idea to drink before you have someone pierce you. Correct piercing technique can still result in small scars, so be aware of that and accept that before you get needles shoved through your skin. Lack of proper sterilization can result in infection that goes for the workspace, the skin, the needles, anything that needs to be sterilized correctly. Make sure your partner tells you any health issues or any medication they're on that has to do with blood clotting or blood in general. These are important to know before you do anything. If needles are too shallow, the skin can break or tear because it can shove up through the skin. So make sure that they're not too deep so they're hitting veins, but they're not so shallow that as soon as they move that it's just going to break through the skin. Emotional precautions. Never let someone pierce you if you don't trust them. It's not a good idea. If piercing is part of the scene, always have a safe word. If your partner can't speak, you should have a nonverbal safe word. Worth it to note that "oh shit" is a bad safe word for a top. This can be emotionally exhausting. It can also cause people to go into shock, so you have to keep tabs on the person that you're piercing and make sure that they're not freaking out or going into shock. Your partner may experience drop after the scene. So make sure you have budgeted time for aftercare to discuss it and decide if this is something that you're comfortable doing again, if they hated it, if they liked it. These are important things to know. Okay, so process. How do you do this? Oops. So for your supplies, you're going to need a sterile environment. You're going to need gloves. You're going to need gauze, sterile alcohol. And of course you need your needles. These can be 18 gauge, 25 gauge. Don't do anything bigger because it will damage too much. If you do anything smaller, it can bend inside the skin. You're going to need your sharps container. You should never put these needles anywhere but a sharps container. And you also need end caps if the person's going to be moving around a trash bag in water if they start going into shock or looking a little like they're going to pass out. Okay, so you're going to pierce right through to the dermis, pierce about 1 millimeter under the skin. So you're going to pierce right under there, not further down. So, process is you're going to set up all your supplies. You don't want to go looking for some later. You're going to wash your hands thoroughly, put on gloves, and then you're going to clean the skin with antibacterial soap, and then you're going to sterilize it with alcohol wipes. And then you're going to check with your partner, make sure they're breathing, make sure everything's going okay. And then you're going to pull up a small section of skin wherever you're piercing, and you're going to make it just up enough so you can shove the needle right under it and make it so that it's parallel to the body. And then if your partner's going to be moving around, you should place end caps on it so that you don't poke them or you, again with the blood transfer being bad. So then you can insert as many needles as you wish, you can lace them up, you can put feathers on it, whatever you want to do. And then when it comes time to remove them, you're going to wash off any dried blood that's on the end of the needle so you're not pulling dried blood through the skin. And then you're going to put the needle back to the skin without tilting it. And you discard all used needles into your sharps container. And then you're gonna wipe the wounds, dress them, make sure they're not excessively bleeding, and then you throw away all your used material into a trash bag. You put in another trash bag so it's separate and it's not contaminating things. So, final thoughts regarding this. Can be rewarding, can be used for a lot of reasons, and it can be something that people really like to do, but you have to do it safely. Because if, you know, the person that you're piercing shows up the next day and they're like, hey, I have a really terrible blood infection, you're probably not going to be trusted to ever pierce anyone again. So you want to be careful. You want to make sure that you're not just giving people infections. These are the sources that I used. They include this book called Plague Piercing and a few websites and then a journal regarding bloodborne pathogens. Are there any questions? Yes.
How long do people usually leave the needles in?
Really depends on the person. So generally how long, if it's for a photo shoot, then it's going through the photo shoot. If it's for like a scene, then it'll be however long the person can stand it. Generally it's 10 minutes to an hour. It can be longer or shorter, but it shouldn't be much more than an hour or two because these are not temporary piercings. Yes?
Do you have to shave the area that you're going to do that with?
You can, but you don't have to. A lot of people don't. As long as it's sterilized, it's okay, but it's, you know, it's not a bad idea. Okay, cool. Thank you all for watching. Oh, yes. Were you saying something? You raised your hand.
Do you draw blood every time you pierce your skin? Does blood
Generally,
ooze
yeah.
out?
You'll have little droplets of blood. If you're careful and you don't hit any veins or anything, there won't be too much. It won't be like excessively bleeding. You'll have some blood on the needle and some blood around the area. And once you take it out, there'll be some blood, which is why you want to clean it off and dress it. And then maybe take a nice shower afterwards so that you can make sure the area is clean.
How deep does the needle go into the epidermis?
Oh, it goes about 1 millimeter under the skin. So it's really not that deep. It's just deep enough so that the needle won't just pull out and break the skin. But it's not horribly deep.
What do they use to stop the bleeding?
You just dress it like you would a normal wound. So like if you cut yourself, you know how you just put a bandage on it, clean it, put a bandage on it, just like that. It'll stop on its own. It's not anything worse than a superficial wound.
Okay.
Thank you all for coming. If you'd like, you can review this, which is a chart of where is best to pierce depending on your ability level. This is a tattoo pain chart, which shows which places hurt more on most people, though that will vary. And you can take one of these handouts, which has to do with pipe piercing. Thank you all for your time.